I'm going to show you today how to use some of the reports we've built with the Irish Primary Care Research Network in collaboration with the ICGP, the HRB Centre for Primary Care Research in Western and Galway. You can find our reports here in Reports, then you go into Patient, and you go into Custom Reports. So you'll find all the reports that we've developed or we're currently working on here in the Custom Reports section. Today I'm going to show you how the Diabetic Register, the Type 1 Diabetes Finder, the Type 2 Diabetes Finder, and the Diabetes Uploader works. So the very first report that we developed was a way to collect in real time any patient who's coded in a practice, who has an active code in a practice as a Type 1, Type 2 or gestational diabetes, whether they're coded ICD-10 or ICPC2E, to remove all duplicates and to show them on a single page. So that's what we did. If you double click on Diabetes Register, what you will see here is a list of all patients who are actively coded as diabetes. This is a real database, and what I've done is I've scrambled the names and addresses of all the patients, and there's a few test patients there, Andrew Murphy, myself and Tom Fahey. So what this shows is, at a glance, you've got 28 Type 1 diabetics, 101 Type 2 diabetics, and 0 gestationals, because I haven't started coding our gestational diabetes yet. But what this tool does is it removes out duplicates and shows you in real time how many patients you have currently coded as diabetic, and it also gives you their name and contact details. So you can see I've got 28 Type 1s and 101 Type 2s. Now, that's great if you've got all your patients coded as Type 1 or Type 2 diabetic, but a lot of people don't, or a lot of people have most of their patients coded as Type 1, but new patients come in every day and sometimes we don't get around to actively coding them as diabetic. So we had to develop a tool that would actively find patients who may be diabetic but who haven't been coded as diabetic yet. And the most logical way to do that was to base it on either prescriptions or previous HbA1c levels. The Type 1 Diabetes Finder works on that. We've restricted it to finding patients who may be diabetic based on the previous prescriptions they've got. You can see I've just created a new test patient there, John Smith, and you can see that he's not included in the list as Type 1 diabetic, but he's coming up as a possible diabetic here because he's been previously prescribed insulin. So let's create another patient. So let's say a new patient comes in, and we'll call them Smith Peter, 1st, 1970, Galway. So this new patient has come in, you start a consultation and you put in your consultation note, reviewed patient today, script given, new patient to practice. And let's say you didn't get around to coding them, but you did get around to give him a prescription for his insulin. It doesn't matter what insulin you give him, all of them link in our system. Okay, so you've given him his prescription, let's say it's a handwritten script. So Peter Smith, this new patient, has just come in, he's got a script for insulin, but you didn't go around to coding him. So he's a patient of the practice who does have diabetes, but he won't come up on the diabetic register because he's not been coded yet. So now if you run the possible Type 1 Diabetes Finder, he should, there you go, Peter Smith comes up and he's been suggested to you as a possible Type 1 diabetic because he's previously been prescribed insulin. You'll see he hasn't been added yet. So Peter Smith, date of birth, the 1st, 1970. So let's go back. Consultation, 1st, 1970. So this could be done once a month or once every couple of months. You could go through the list. And then what you need now to do to add him into the register, you start a new consultation and you want to code him as diabetic. Now you can use ICD-10 or ICPC2E, that's fine. Double click on insulin dependent. Click active, really important to click active there, and he's now currently coded as diabetic. So if you run the diabetic register now, you'll see that our numbers have gone from 28 to 29 and Peter Smith has been added in. So you can see in real time how easy it is to code, to first of all find, then code, then add patients to a diabetic register. Exactly the same thing works with Type 2 diabetes. This will suggest patients who've been prescribed with medications like metformin or glycoside, patients that are likely to have Type 2 diabetes. But we've also added in an extra element as in HbA1c levels. If they're normal, they come up in green. If they're abnormal, they come up in red. So you can see that in combination of the combination of those makes it really easy to find patients. You'll always have more suggested as possible Type 2s because it'll include people with PCOS or who are borderline diabetic. But you can see here this patient here is likely to have diabetes because he's got metformin. Other ones have elevated HbA1c levels. This patient is on glycoside and metformin, so they're quite likely to be diabetic. You can see this is a really easy way to find patients and to then add them into the diabetic register. So that's it. That's how the type 1 and type 2 diabetes finders work. So these will suggest patients that might have diabetes. It gives you a chance to go into the chart, then code them as actively diabetic, and then they'll be added into the diabetic register. And the diabetic register will give you a full list of all the patients, which will upload in real time. Now, that's a tool for finding, coding your diabetic patients. The next thing which we're really excited about is the Diabetes Uploader tool. So all you do is you click on Upload, you click Agree, and you click Run. And what will happen is we're hoping after about 5 minutes, you'll get an email into your practice email account with an audit of your patients. So feel free to try that. You'll get an email hopefully within about 5 to 10 minutes of your total number of diabetics and also demographic breakdowns, and we're hoping to add that and to build on that over time. But the more times you upload it, the smarter our server becomes, and we're able to generate more accurate research audits each time, which then you can use internally in your practice. So they're the first 4 tools. You can play around with the rest of the tools we've developed as well, particularly the maternity safe prescribing tool. Just to show you quickly, what this does is anybody who's currently receiving antenatal care will be audited here, and if they're on any medication that could potentially be harmful in pregnancy, you'll automatically get a warning. So you can see here I've got 3 Mary blogs. These are all real patients. One's on citalopram, one was on amitriptyline, and one on paracetamol, and you'll just get a flag here for any warning. So there are the tools that we do: our register, the finders, and the uploader tool. There's other tools as well here that you can play around with, such as our CKD tool, which finds patients with chronic disease really simply just based on EGFR and stacks them up. So lots of areas there that you can use for generating data for your own practice. I hope you find it useful. Thank you.